I certainly think and really want our kids to be able to go back to school. We know that it's so important for their mental and emotional health, for their academic health. And I think that there are a few places like New York that can actually do this safely right now. We're in a very different place than we were in March and in April. We have less than around 1% of tests that are done in New York that are coming back positive. That means there's very little virus in our community. That being said, it's going to be pretty easy to open up schools. It's going to be really hard to keep them open. It's contingent on all schools to have really good protocols and really good plans for what happens when a kid or a teacher inevitably shows up and then tests positive, or if you have multiple kids in a school or even in a class that test positive, or what happens when one of the faculty ends up hospitalized. We know that this is going to happen in multiple different schools, not just in New York, but all around the country. And we need to be thinking about that in advance and making sure we have safe protocols in place that are focused on the safety of students and staff as well as the families. And I'm still waiting to hear from a lot of places to see exactly how that's going to work here in New York and in other places.
What's your latest thinking and what do the studies show as far as how transmissible it is among kids, let's say in elementary school, and how severe their symptoms may be?
We've learned so much over the past couple of months about coronavirus, but quite frankly, the most of it has been in adults, especially sick adults, those most likely to die from this. We don't know a lot about kids, but we're learning a lot more in the past couple weeks. We know that kids can get the virus, they can transmit the virus, they harbor it in their bodies, and they can pass it along. We also know there was a big CDC report that came out today showing that kids can get very sick. You know, if kids get hospitalized, the likelihood that they're hospitalized is 1 in 3, which is very similar to what it is for adults that are going into intensive care. So we know that kids can get it and kids can get sick. The most important thing I think that we're learning about kids is that just like in adults, where this disproportionately impacted communities of color, Black and Hispanic Americans, we see that a lot of infections are happening in those same communities because of the same modes of transmission. And so anyone that is sending their kids back to school and anyone that is overseeing this process needs to be thinking about the fact this has disproportionately impacted those certain communities, and we need to have plans to make sure that we keep them safe because those populations have already been marginalized and vulnerable throughout this.
Dr. Spencer, as you said, less than 1% of tests in New York are coming back positive, which is fantastic. What level does it have to be below for you to think that it's worth opening schools in another state? Is 10% too high, 2% too high?
We don't exactly know. We've been saying 5%, but I think honestly even 5% is probably too high. Ideally, you want it as low as possible. 1% is probably right now as good as we're going to get it in most places. But there's a lot of other places like Mississippi and Texas, Florida, Alabama, where the positivity rate is over 5, over 10, over 15, in some places over 20%. In those places, it's absolutely crazy to try to think that we can safely send kids back to school. They will show up with the virus. They will transmit the virus. They will get sick, and they will pass this along to their teachers and their family. That's why all of us have been saying for so long, we all want the schools to open. Everyone wants the schools to open. Public health experts, I'm a parent as well, but we need to make sure that we're doing it safely. Sending kids back into class when there's so much virus in our community is a recipe for disaster and is bound to fail.
How much longer can New York stay at 1%? If we're reopened, we're in phase 4, so that's been going relatively well. But as this continues and as schools open and as cases grow in many other states in this country, what's your expectation for what happens to New York into the fall?
All of this really depends on how well we continue to do the exact same things we've been told and we have been doing over the past few months. Masks, social distancing, washing our hands, being very smart. I think that we can continue that here. I have a lot of concerns, of course. Once we do open schools, there will be some more transmission. I'm more concerned about what happens this fall and this winter if we have a really bad flu season, if people don't get their flu shots as they should, and we have this mix of coronavirus and influenza. I think this could potentially cause some really big issues in our communities and in our hospitals. As of right now, I think that we can, and I'm encouraged every time I walk to work or go out on the streets, the majority of New Yorkers are wearing a mask and doing those really important things that drive down transmission. But we have to worry about complicity. People are getting quarantine fatigue. People are getting fatigued with all of this. As long as we keep this up, we can keep this virus down. But as soon as we let up, as we're learning from many other countries around the world, the virus will come roaring back.
Dr. Craig Spencer, thanks for joining us.
Thanks for having me.